Good morning, good afternoon, good evening to all of our attendees and viewers. A very sincere thank you for joining us today, and a very sincere thank you to our panel members. As you are all aware, we are here for our roundtable of June 2021, and the topic of discussion is, are we ready for a mental health pandemic post-COVID-19? This has been, of course, a very unique and novel year for all of us, without question. The difficulties that we've experienced, the difficulties that we've all had some relation to in one way, shape, or form, will definitely be remembered for years to come. I would like to inform all of our guests as well that this is a recording that will be available after the roundtable as well. Without further ado, I would like to introduce our respected panel members today. So we are very lucky to have Dr. Swapna Vaidya, who is the Chief Psychiatrist in Kaiser Permanente in Washington. We have Raymond Barrett, who is the CEO of Telemedicine Telehealth Certification Institute in the US. He is a licensed professional counselor as well. We have Dr. Nikos Gkouvas, who is a psychiatrist from Greece, and he is the president of Informatics and Innovative Technologies of the scientific branch of the Greek Psychiatric Association. We also have from Canada as well, Cindy Allison, who is a managing partner and clinical director at Pathway Therapy. She is a registered psychotherapist. And last but not least, we have Dr. Suparna Telang joining us from India. She is a psychiatrist with nearly 2 decades of experience working in sexual medicine, developmental disorders, as well as providing consultation across the country. So again, a very experienced, a very insightful panel we have today to discuss this topic at hand. So as mentioned, without question, this year has been difficult, to say the least. Mental health has been an issue that has, of course, been emerging with greater attention being put forth to it as well. And I'd like to open the scene, and I'd like to open the call with a bit of a general context, sharing a bit of a statistic with you. So there was a survey released in 2020 and measured up until 2021 by Statistics Canada. This survey looked at the mental health of Canadians during the pandemic, and it was found that 21% of Canadian adults aged 18 and older screened positive for at least one of 3 diagnoses, and that includes major depressive disorder, generalized anxiety disorder, as well as post-traumatic stress disorder. So I'd like to emphasize here these statistics. That is 1 in 5, 21% of adults, which is a significant statistic. And I'd like to move from that statistic to our first question that I will be putting forth to each of our panel members, and that is, what do you feel are some of the types of impact, in addition to these, that COVID-19 has had on mental health? And I'd like to put the first question to Dr. Swapna Vaidya. If you could kindly comment on some of your thoughts relating to this question, that would be greatly appreciated.
Sorry, I think I was on mute. Sorry about that.
No problem.
Hi,
No
Dr.
problem.
Vaidya. Just wanted to correct you. I'm the chief psychiatrist of 2 clinics in Washington. One is at Bremerton and one is at Tacoma.
Okay.
So yeah, I just wanted to kind of set that right. And I think that it's a very relevant question in this context. Washington State actually ranks pretty low in terms of access to mental health care as such. And what we have noticed in the pandemic is that this access to care and the lack of it has become even much more apparent. I mean, at any given day, we are fielding calls between 500 to 1,000 calls, and we are in the process of trying to, improve rapid engagement and looking at novel methods to help our patients. One thing that Kaiser did do, which was very instrumental and sort of like radical in the beginning, was pivoted to telepsychiatry almost overnight during the pandemic, which did improve and which did kind of like help our members access care, especially the ones who wouldn't be able to travel. However, I do feel that this is just the beginning of tele-technology that we are seeing. And what I am seeing right now is I'm seeing like post-pandemic, and we are sort of recovering in a sense of that the state is about 70% vaccinated. There is still an immense need because of the issues of social isolation, issues around teens and adolescents. I think that's the population that's really been suffering the most, and the crisis calls that we've been fielding. Rural areas really suffer, and I do feel that with the expansion of such platforms, perhaps such as Solve.Care, can probably, kind of like create an equity when it comes to healthcare, because we have some patients who have socioeconomic issues, or, sort of like other barriers to care, which might not be able to helped out from the traditional methods of, sort of like coming for appointments and whatnot. That being said, we're also looking into integrated models of care, wherein we can connect with patients at the level of connection that they are at, whether it's at the primary care or the OBGYN or whichever doctor that they have approached. So these are the sort of things that we are, sort of like doing at our end. But nationally, as you said, and you talked about the statistics in Canada, similar stats exist in the USA as well. I mean, there's been about a 42%, I think, or even close to 50% now, incidence of depression across spectrum in all ages. So definitely there is a need, and we would need to kind of like come up with innovative and quick solutions to satisfy that need.
Got it. Thank you for that, Dr. Vaidya. I think one of the interesting points you mentioned as well is kind of the demographic that it has affected with the younger generation as well, kind of, being removed from their everyday interaction as well, and having that isolation and loneliness as well. Raymond, if you don't mind also sharing some of your experience as well with respect to what you feel some of the types of impacts that COVID has had, maybe that you've seen in your area of practice as well.
Sure. Yeah, and thinking about the question, thanks for having me, by the way, Ahmed. Glad to be here. Yeah, and thinking about the impact of COVID-19, I think the impact of the virus biologically on someone, on the brain in terms of behavioral health, and then there's the impact of the response to COVID, right? So those are two different things. And I think a lot of research still has to be done on that. I don't think we're clear really on the impact of the virus itself on mental health, biologically. And then in terms of the impact of the response, well, before I get to that, there's, obviously there's fear, there's sorrow, there's grief. Death is a permanent impact, right? And people are grieving. And then with the response, people have lost jobs. Some people have lost people to death. So there's going to be, definitely a ripple effect there. In terms of the behavioral health needs, in the US, there was a national study done on this, and 4 out of 10 people struggle with anxiety and depression, right, post-COVID. Whereas before COVID, it was only 1 in 10. So you went from 1 in 10 to 4 in 10. That's a really big impact. Now, and also in terms of the impact of COVID-19, I think we could look at the individual level or the aggregate level, right? So the statistic I just gave is the aggregate level. On the individual level, some people thrived during COVID-19, right? So it depends on the individual. Some people love working from home. They like the fact that there's not as much expectations of them to socialize and get out and do so many things. Some families really bonded and connected during COVID, having a lot more time together. But then there's other families who don't have as many resources. Kids are at home without supervision. Families have internal conflict, which only gets worse when they're together for long periods of time. So it really depends upon the individual. If you think about homeschooling, right? People have always done homeschooling. Well, not a very big percentage of them, right? Those that thrive with that kind of thing do well. So in terms of the impact of COVID-19, I really do think there needs to be a lot more research on what helps people during these periods of time and what doesn't. And I think people's response to that has a big impact. When you look at equity and disparities, one thing I think we need to look further at is health and digital literacy or technology literacy, right? And then also access to technology. So some people during times like this, they naturally gravitate towards using technology to communicate with others. They do that well. It's not stressful for them. It's normal. some people don't have access to the technology, or not sure how to use it, or they have a distrust of it, etc. So I think COVID definitely, put us all in the place of having to use technology a lot more, especially in the healthcare world. And so I think it kind of opened people's eyes of the usefulness. We do have some systemic issues that have gotten in the way, right? Like reimbursement because of false myths, right? So people like phone sessions for behavioral health in the United States, right? Having a phone counseling session, right, in the United States was typically not reimbursed. Now, research shows it's just as effective as if you're in the same room as a client. And again, you need to look at the individual level. It works great for some people, it doesn't work great for others. But I think, busting these myths and showing how telehealth is very effective, the usefulness of it, and supporting that with reimbursement helps a lot. So, yeah, in a nutshell, I think that we need to continue to do research to look at how do we respond to these kind of things? How do we support people? What are the conditions that allow people to do well in these kind of situations? And what are the conditions that set people up for real issues?
Makes sense. No, thank you for that. One of the areas that I really enjoyed hearing about was your mention of the access to resources and how that really has an impact on someone's experience, during isolation or lockdown. And I think that's a point that's often overlooked is some of us, some people around the world have less resources, some have more. And that has a profound impact on kind of how they thrive or how they cope or how they really kind of go downhill, unfortunately. Thank you for that. Dr. Gkouvas, would you like to kindly comment on this question at all from your experience and your practice as well? Oh, you're on mute, Dr. Gkouvas. Yeah.
First of all, I have to thank you again for being here, and for the rest of our speakers too, because I concur 100% of what they said. I want to add my personal experience that before COVID, there was a time that when we were talking about telemedicine, we seemed like coming from space. And I'm talking before COVID, not 10 years ago, months ago. Just in January, I was in the university talking about the use of telepsychiatry and how effective it is and how we have to use it to do things. And there were professors are talking to me like I was talking about their first, quantum computer in the psychiatry, something like this, whatever. COVID came to show us that things are different and that telemedicine is here to stay. Of course, we have to not to lose the momentum, because my personal seeing after the thousands of sessions that happened in Greece, at least during COVID, that we have to get this momentum and take it a step further by seeing how we're going to see about data, what happens about data. It's the key discussion. And to my knowledge, Solve.Care solved it before, but people don't know they're analphabets, as we say in Greek, regarding technology. They don't know what are the benefits of using one video or another. For example, for everybody, Skype and Solve.Care is the same, or whatever else. It's a video. That's why we need to educate them more and understand what are the key differences and we have to psychoeducate them on how they use technology at this point. And of course, I think that the COVID thing helped a lot to put how can I say, to get things move further and faster. But at the same time, we have to be very careful on what we say to people around us so that they get this correct information and move forward. There was a big study called Covet that happened during COVID through the Saloniki University in 55 countries, and showed that we are waiting after from September and on a raise in almost 10% in mental health problems, which is a huge number, 10%. And telemedicine is here to stay and help the situation, because we all know that even in the US, that has serious problems of having doctors in specific places in the US. There are no psychiatrists. There's one psychiatrist every 800 miles, for example. If we go to places like India or Africa or other places that psychiatry is not so much known, and there are not a lot of doctors, only telemedicine can solve this issue. So I have to think that those that we understand what happens and we want to see things change, to be in a correct leading way to find solutions about getting telemedicine in the place that it should be.
Got it. So I think what I understood from you is that, one of the impacts as well is the understanding or need for adoption as well to incorporate telemedicine or some sort of technology in the treatment of mental health. Yeah, no, very good points. Thank you for that, Dr. Gkouvas. Very much appreciated. I guess with someone who on my side of the border as well, I'd like to refer to Cindy Allison. Would you kindly be able to comment as well on some of your experiences in your practice on this topic?
Yes, absolutely. It's good to be here. So, here at Pathway, we've been monitoring pre-pandemic, post-pandemic. During this period, there's a huge demand for services in this past year. We've seen that, as we're seeing COVID-19 spread across, it has had major impact on a considerable amount of people with our usual clients, but then also with people that are coming in and saying specifically that it's COVID-19 that has affected the way that they live. There's a huge degree of fear, worry, concerns, financial burden, stress amongst people within the family household. Raymond has mentioned with parents, families, partners, the way that children are growing up and they're socializing, the way that we're telling them how to be in the world is shifting and changing. And so even with that, the amount of stress that parents are experiencing, families are experiencing, people that are living alone are experiencing. And in particular, I found that it's affecting certain groups also, such as adults in long-term care providers, right? So medical doctors such as yourself, being able to kind of have space for yourself, being there, being for others, caring for others, and then not knowing how to care for ourselves even. There's a huge demand with people with underlying health conditions that are being affected by this. There's a lot of different types of fears and worries and concerns that are coming up. I found that, the psychological impacts that have been up to date is heartbreaking to say the least. Like the elevated rates of stress and anxiety seems to be permeating across the board with everyone. So as opposed to certain milestones or situations, in things that people would have lived in, particular things that are coming up for them, is just now a daily pertaining thing that is just, we wake up with this kind of stress, we wake up with this certain uncertainty, right? So in that way, I would say that it feels like across the board, we're all in different boats, but in the same storm is what, I've been seeing across the board in the conversations that we've been having. And then also the measures of quarantine that has been in different parts of the world. So for us here in Canada and Ontario, right, it's affected people, I would say activities, routines, livelihoods, small businesses, the way that we've seen the ups and downs. It's almost feeling like this is just the normal part of the world, which shouldn't be and isn't. The increased levels of loneliness, depression. There's unfortunately so much harmful alcohol, drug use, self-harm, suicidal behavior that we're seeing that has been on the rise, right? And we're trying to do our part in navigating that, but at the same time, also creating space to have the dialogue, to be able to create support for everyone, and then not being able to, that's disheartening, right? So I would say that it feels like many of the long-term impacts have not fully been understood yet. At this point, we're just at the crux of the beginning of it all, witnessing and trying to do our part, but not sure how to prepare ourselves in order to provide the right care for people from years to come. And I would say I see this, within myself and my family household. I have a 2-year-old, and just witnessing how, naturally, if you asked me 2 years ago, how would I like to raise my child? It would be very different from the response that I have today. But even seeing my child be in public and witnessing other people with masks on and not being able to understand facial expression, understanding, the psychological impact that this would have and how this has been across the board, and economic disparity and the ways that it actually impacts different family households because of that, right? So at the end of the day, it feels like without a doubt, this has had a huge impact on people's emotional, mental well-being, and the degree of how long lasting this will be feels very uncertain, right? But at the same time, some of the things that have come out of it, which I agree with a lot of the speakers already, is that, with technology, with the ability to kind of step forward and move forward and accept technology, has been able to give us more access, right, to care, and also be able to reach a wider range of people, I would say.
Makes sense. And I think one of the points I'd like to elaborate on that you'd mentioned, very similar to what Ray had mentioned earlier, is, the household almost becomes a school. It becomes your place of residence. It becomes an office. It becomes a playground. And as you mentioned, there are a lot of factors that impact that either positively or negatively. A lot of those are resource dependent as well. So no, very good point. Thanks kindly for your insight. Dr. Telang, would you also be kind enough to comment on this as well from your area of practice and some of your experience as well?
Yes. All of them who have spoken right now were from a much smaller countries as compared to my country from where I come. It's a very, very diverse population. And because of the diversity of culture, language, educational status, everything, it had much different, I would say, different in the sense of expression. Anxiety was anxiety, depression was depression, PTSD was PTSD. But the levels of frustration, the levels of insecurity were really very different. Children who were going to school, the school-going children, had to study from home, which they are not used to. They're used to sitting with their friends and working. Here they were sitting in front of their computers, their laptops, and they were working, which was very boring and frustrating for them, more than the fear of just COVID. Second level was adolescents who are used to mixing up with their friends, and they go to schools and colleges more so to interact. They were also at home. The young adults who were doing jobs and had lost their jobs or working from home, again, it was a different environment which they were not used to spending so much of time with their families. And then the family interaction was not necessarily when everybody is frustrated and depressed. There were frictions in the family. Senior citizens were a different group who suffered a lot of insecurity, anxiety, and fear of death, a lot of it. So what was, at the same time, there was another group, which was caretakers of the patients. Till the patient was in the hospitals or COVID isolation centers, the family did not have to worry about them. But once they were back home, taking care of these patients as well as managing the family really burnt them out emotionally, physically, everything. And the technology here really came as a blessing and a boon to us, because with such a huge population, and we do have a lot of psychiatrists. The group of psychiatrists started group therapies, not just individual, but group therapies wherever they could reach, forming NGOs and letting out their numbers 24/7 to seek help. That was a wonderful effort they could do, that people who had only telephones, maybe just mobiles, maybe landlines, they all could reach these groups, these NGOs, and ask for help. But I have a very strong feeling that after this, I feel there should be an umbrella under which all these NGOs should work. I shouldn't be saying that, but somebody like Solve.Care should take up like an umbrella organization and unite all these people to provide help to this. There were incidences of attempted suicides, not just in adults, but even children who got really frustrated for being at home for months together. We had a lockdown for almost 9 months in the year 2020. And even now we had it for almost 3 months. So students were confused, people who were doing their board exams, they had no exams, they were preparing for it for the whole year. So different groups reacted in a different way, and to them, technologically also, they could ask help in a very different way. So I think it has blessed us to give and reach them with some amount of help.
Makes sense. Thank you for that, Dr. Telang. And I think also, all of us around the world have witnessed, some of the tragic aspects for the second wave in India as well. So I'm sure in combination with the second wave of COVID and those social aspects as well, it just must have been profoundly difficult. So thanks kindly for your comments. So I think, to our audience as well, it's clear that COVID has had significant impacts on the short term, but I'd also like to talk about the long term as well. In the context of COVID and the years to come, I'm sure we'll look back in a moment of history and kind of see these 1.5 to 2 years as just, a component that has had ripple effects for years to come. And on that note, I'd actually like to share a bit of a statistic as well produced by the Public Health Agency and StatsCan. So, they were looking at incidences of, aspects of depressive disorder, anxiety. And one of the areas I'd like to focus on is PTSD. So in a recent study in 2020, it was found that a population of providers and the general public actually had an approximation of 13% incidence reported of PTSD, compared with a percentage of 2 to 3% the year prior. So I'd like to kind of use that statistic as kind of a pivot to our next question for our panel members. And that is, what do you think some of the long-term impacts of COVID-19 are with respect to mental health and how that'll impact the general society? So I'd like to turn that first question to Dr. Swapna Vaidya again, if you could kindly comment on that question from your insights.
No, absolutely. And thank you again for the question. And, also thank you for all the panelists learning from, everybody's experience and different sort of like populations that they are facing. So yeah, that's actually a rich sort of experience to even learn what's going on around the world. So one of the things, I would say that you got to learn from history. One reason we are very concerned about is this potential long-term impact, because we've gone through previous national emergencies, whether it's been through 9/11. I was there actually in New York. I was a psychiatrist there, as well as, things such as the hurricanes. And if you really even want to go and look at some statistics for pandemics as such, after the SARS pandemic, I believe there was about a 20 to 30% increase, not just in depression, but in suicides and PTSD. And similarly, with the statistics, if you see post 9/11, fear about living in taller buildings or fear about taking the subway. So there is going to be a long lingering effect, of this pandemic in terms of the post-traumatic stress. As some panelists said, there was job loss, there was a financial struggle, a global economic downturn, and that is going to be associated. You're going to see the repercussions for a long period. So historically, all these adverse mental health effects of disasters, they impact more people and they will last much longer than the physical effects that we may see. But the other thing that everybody is looking at right now is the COVID virus itself and how it actually can cause some neuropsychiatric issues. We've had some studies and actually case reports about patients with delirium, patients with pre-existing dementia rapidly declining. And again, there's been not concrete evidence, but there is research showing that there could be a direct link of the virus itself with the cognition and with the ability to think. There was another research actually done, I think it was a 24-year retrospective research, and that was done, I think, in Ukraine. And they found that this was about the Chernobyl incident. that the first responders, we talked about people who are actually going and helping. And this was also post 9/11, the rates of depression and PTSD almost doubled in them. So the statistics are definitely there. So I think that as the doctor from India said, I think Solve.Care could really form an impact here by being proactive, whether it is kind of like, grouping together these NGOs, as she said, or even globally, if there is a way to kind of like, look at this proactively and think about what the, the impact is going to be, and then be proactive about resources, that would be very, very helpful. The other issue with PTSD is obviously the recurrence and the fear of losing someone again. This was also found again in a lot of studies after such pandemics or after disasters, that several people felt like life was moving forward, but that every time they were out, they were not the same. Obviously, there's no actual, kind of like confirmation as to how and where and how much the ripple effects will be there. But I would say that there will be long-term effects on well-being. And we should actually look at recommendations which have been published. I think there are recommendations published by the WHO about safeguarding mental health. There are similar guidelines issued by the US government. I think about in UK also, APA, which is the American Psychiatric Association, also published a report on how people can better cope. So in terms of that, I do want to like talk about resilience and hope. That is one of the main sort of like tool. And I think that psychiatrists will also say that it's important to recognize that there is a positive takeaway to this. Even after this pandemic, for instance, in countries like New Zealand, there were large gigs, that were organized, large events that were organized to sort of like, acknowledge the losses that happened, but also signify, the start of a new beginning. So similar events would occur post-pandemic. And I think that that is what would connect people together. So I do feel that increase, kind of access to mental health care, thinking about novel ways to reach people, thinking about the equity. I keep talking about equity because this is, even if we are in a country like United States, and yes, it is a definitely rich resourced country compared to developing countries, yet you see the equity of health disparity, whether it's in race, socioeconomically, and, gender. So I do feel that there is a lot more work to be done. So we need to definitely have a balance and find the rebalance, in this new world, as I say, and recognize that we need to be cognizant to our patients and understanding that we will be dealing with this and we will be needing to help people for a long time from now on. Thank you.
Thank you for that, Dr. Vaidya. Yeah, very interesting. And I think one of the points that I took from there is, in reference to the tragic events of 9/11 as well, we saw, as you mentioned, a lot of fear in terms of the after effects of people even to enter tall buildings as such. And I think, with COVID as well, we may see a similar fear of people to even enter hospitals or seek treatment in the future as well. So very good points. Before I turn it over to Raymond Brett as well to follow up on this well, I'd just like to remind all of our attendees, please feel free to put in your questions in Zoom and we'd be more than happy to answer it in the next half an hour. So on that note, Raymond, if you don't mind sharing some of your thoughts on this topic as well, in terms of some of the long-term effects, I'd be happy to know kind of some of your thoughts from your practice as well.
Yeah, well, I certainly second everything that's already been said, about the long-term effects on mental health, especially with PTSD. In terms of the systemically, the long-term impacts, I think there's learning that we can get from this. One thing is, I think it's absolutely incredible. This is something to celebrate, how adaptable we are as humans, right? I've been doing telehealth for a very long time, right? I'm the CEO of the Telehealth Certification Institute. So we've been doing this for a long time, and I every day I'm studying and learning more about telehealth. So I know it takes preparation, et cetera. However, hospital systems have gotten telehealth up and running in 1 to 2 days, right? Schools were not used to doing virtual schooling at all. Immediately, they put Chromebooks, computers in the hands of kids, gave them, instruction, gave guidelines. I mean, people got up and running with doing things virtually very, very quickly. The government had a quick response with, getting, financial resources to people in need. So I think there's something to really celebrate here. When we're talking about hope and resilience, I think that's really important to point out. I think there's a difference between responding to something in a way where we come together and we support each other as equals versus division. So, throughout the world, you probably all know that there's been a lot of division in the United States, which has been very hard, very sad. And I think those kind of things that have happened that have created division, those will have a long-term impact, unfortunately. So hopefully we will learn from that and avoid that and have more of a response of coming together in hope. Another thing is preparation. So hopefully we've learned from this so that we're better prepared for these things. Again, I think we had a lot of preparation, but hopefully we'll have even more and better improved preparation for any kind of disaster. Right now we're relying on the internet. What if that was just gone, right? Like, how do we respond to these things? Now we do have organizations in the United States like FEMA, that responds to these things, and they have protocol for responding to crises, which I think would be very helpful for all communities to be really aware of. And then another thing is getting care. The sooner people can get care, the better, right? And one of the obstacles to that is stigma. So we have an opportunity with COVID, knowing that many more people are struggling with anxiety and depression. Hopefully that could kind of normalize it a bit. Like, yes, this happens. There's no need to feel shameful about it, but let's, as a nation, as a world, let's destigmatize it, help people get screened, and help people get help in a way that is equitable, right? So I think there's really an opportunity there that the response, as it was already mentioned, acknowledging the death and the grief would be really important. I will just stop there.
No, thank you for that, Ray. And I think one of the points you'd mentioned as well, kind of focusing on contingency planning, is really important as well. So looking at the responses of hospitals, looking at the responses of schools, I think, as you mentioned very rightfully, if there's one thing as well that we've learned from this as well, is that we need to have those aspects of contingency planning in place. So thank you for that. Dr. Gkouvas, I'd like to turn it over to you to ask for some of your thoughts on this as well, please.
Yes. In general, I have to, Mr. Barrett said correctly, what's the case that came up from all this situation with COVID, meaning that if we're not get prepared, because COVID isn't over, the whole thing now, it comes down to if the vaccination is going to be finished correctly, and seems that it's not going well. At least in Greece, there are a lot of people that are going slowly to be vaccinated, and maybe this may get us to a point that telehealth again is going to be the primal and only way to see doctors if the wall of immunity doesn't grow up so that we can move as we want to. In general, I believe that the main issue here is to be vigilant and see what we're going to do to educate people. I think that is the key thing about everything is to make the correct channels and educate people about what's happening, what they can do about it, and what they can't do about it. If we focus on this thing correctly and give the correct and the right people to do this, I believe that everything is going to be better, and we're going to find solutions easily in anything that may happen. COVID in reality is not something so bad, meaning it's bad. A lot of people died, but there are a lot of viruses that are much stronger, much worse than COVID. And the main issue about the deaths had to do with less of education of people, what to do about it. We lost a lot of time about educating and getting to understand what happened. And that's why we had in Brazil thousands of deaths. And the Prime Minister to say that It's not a need to wear a mask and things like this. So in the same context, if we are focused on educating everybody what to do and how to do it, and especially in the mental health sector from my end, because the things are growing very fast and we see the change in the way that people were coping all these things, because we saw couples after 30 years of marriage getting together. We saw families getting together after 20 years. And these things generated new stress, new issues, or issues that were kind of under the rug and came up at that time. And we are here to see how we can help either each other or even the policymakers to make correct judgment calls and not be focused only on who's going to get the mask or not.
Makes sense. Thank you for that, Dr. Gkouvas. And I think, as you said very rightfully, one of the main points is education. And, to educate, whether it's depending on the audience, and sometimes virtually, and telemedicine is a vector through which that education can be permeated. So thank you for that. I'd like to turn to Cindy Allison, if you could kindly offer some of your thoughts and insight on this as well, please.
So I'm thinking about, your question with long-term impacts of mental health caused by COVID-19, right? So, in particular, in my area of work, I work with childhood trauma that affects itself in adult life, right? So the way that we understand ourselves and then the way that we understand others. Like, so for me, immediately, being on the ground, working with people day to day, working with my colleagues, this is the conversation that we're having. And I'm seeing that, as humans, we rely on connection. We rely on connection for healthy development and for healthy wellness, right? So it's hard for me to see beyond that at the moment because of dealing with everybody that needs help right now, dealing with adults, dealing with children, and seeing how this is a ripple effect of things that will change the future in our history in a sense, right? So the impact of what we're going through right now is globally, but then also by nation, by province, by state. It depends on how it's being governed, how it's being handled, right? And in those ways, right, it makes a huge effect on the ways that our children, ourselves are being able to see and move forward into the world. Like even in Ontario right now, things are starting to lift and we're starting to get out there in the world. We spent the last year and a half being in isolation, to our own family household and what that means, how we interact with others, right? When I'm thinking about going to the grocery store and I like to hold the door, like an act of kindness is something that you have to think again now, and how that actually affects others. Is it something that the person behind me wants me to do? Do I just move forward? Do I stay away? So it feels like isolation and alienation is continuing to be a part of the way that we re-enter the world. And that's a problem that we kind of have to think about in terms of the long-term effects, right? Because the way that we connect with others and our neighbors and, a smile or not to smile or keeping our distance, right? That actually affects the way that, our general happiness and how we are in the world and our children. And the stress that we carry outside is brought back into the home, right? So, whether that's with our partners, our families, our parents, our kids, our siblings, all of that stress now is permeated in a space that is not released, right? There is nowhere for these feelings to go. There's nowhere to kind of relieve some of this. And so I find that in terms of thinking of the long-term effects and how that affects us in my community, it's definitely a place that I feel that is a problem that hasn't been really answered. And everyone's almost just deciding on their own what their best practice is, right? And it's almost like you're weighing out the risk and rewards of, do I follow? How much do I follow? And what that impacts, in terms of what you see immediately, and then what it means for me overall, right? In terms of my mental health and those people around me. And then also thinking about how COVID-19 affects people differently. As mentioned before, the pandemic, makes existing inequalities, discrimination, marginalized groups become even more at risk. So there has to be different governings or opportunities and funding that I believe needs to be put into these areas that are different for, other different areas that don't need the same kind of fundings. And it actually has to be a conversation that needs to be talked about, that needs to be brought to awareness, right? Like the situation that we have today is great because the thoughts and the expertise that are being brought in are things that, not necessarily in my field, my day-to-day that I think about, but it's definitely something that brings up, I feel like Raymond, for instance, is an optimist, right? And it's really great to hear, right, the things that he believes and the changes that are happening. And then for me, being on the field, on the ground, seeing the disparity, seeing the sadness, the depression, it's hard sometimes to step out of that bubble, right? But all of that to say is that I do believe that there is this, there's two lines, it feels like a reality that is happening. One is that there is growth, a lot of growth in technology, a lot of growth in change, adaptation, right? There's a lot of things that we're seeing about people in terms of resilience and how it's shifting us. And then the other trajectory is that there's a lot of depression, isolation, and lots of negativity, lots of things on the rise, self-harm, suicidal behavior of maybe it's always been there, but now it's actually a part of the conversation as a pandemic, as an epidemic that we need to look at, as opposed to, this doesn't affect me or wasn't part of my world or my community, so I don't really have to think about it, right? So in some ways, it feels like, as much as we're disconnected from our neighbors, we actually care more about the general health and the wellness of everyone around us at this point.
Thanks for that, Cindy. Yeah, no, it makes absolute sense. And I think one of the points that actually stood out to me as well, and something I can comment on from my experience, is, the basic pleasantries that we have with one another, especially as you mentioned at the grocery store. A simple act of kindness is holding the door. Those things need to be recalibrated, and as you so rightfully said, would the person want me to be that close to them to hold the door open? And those types of basic courtesies that we also hope to impart onto the next generation or our children are things that they may not see us doing now. And I think, as you rightfully said, that has an impact on development as well. So thank you for that. Dr. Telang, I'd like to pose the same question to you as well, if you could kindly comment.
Yeah. We spoke about PTSD to begin with, and we started this topic with PTSD. And we have been observing here that the frontline workers, the doctors who have been caring for the patients, as well as the patients, these are the major groups, as well as the caretakers of the patient. They are the people who need a lot of consultation and counseling, reassurance to all of them to prevent PTSD. PTSD, as well as the long-term depression and anxiety, leading to a small, proportionately large as compared to pre-pandemic, anxiety leading to OCD. Lot of them are showing symptoms of obsession and compulsive hand washing, obsession to the core that I have come across a couple of patients who refuse to remove their mask even while going to bed. So it has that type of an anxiety has got into people, children, adults, senior citizens, everybody equally. But the PTSD, which will last a long time after the pandemic, will have to be dealt right now, right at the nip of it, to not allow it to go much bigger and even a longer lasting lifetime disorder. The PTSD, particularly in senior citizens, can become a lifetime disorder. So to prevent that is very important. And here again, what we have been doing is we have been collecting students from the same school and have an online webinar with them, talking about positive things that they should learn from this pandemic, so as to give them a lesser chance to develop anxiety and misnomers about this pandemic. Similarly, the senior citizens group, we've not been able to do that for the middle level of the age group, but we have been very successfully reaching out senior citizens, because they can be put in a group, like they have their clubs. So we have their numbers and their contacts, as well as school children. So we have been helping them through technology in dealing with PTSD as well as a lot of anxiety.
Thank you for that, Dr. Telang. And I think also one of the things you'd mentioned as well is the PTSD that providers can face as well. So looking at things like caregiver burnout, those are definitely things that will have to be addressed in the future. So thank you kindly for that.
Yeah.
Just looking at our questions actually accumulate here, we have an abundance of questions, and I want to make sure that our viewers have the opportunity to have some of those questions answered. So for the sake of time, I actually will transition to one of our last questions for our panel members. And kindly ask you to keep your response within 2 to 3 minutes, so then we could leave a solid 30 minutes for Q&A at the end. So I'd like to turn to Dr. Vaidya to put forth our last question of the roundtable. And I'd like to say that a lot of the commentary that I've heard from you, rightfully so, from all of our panel members, has been focused on telemedicine and how that is an intertwined theme within a lot of the short-term and long-term consequences and needs moving forward. So I'd like to put our question first to Dr. Vaidya and ask, how can telemedicine help mental health professionals deal with the large increase in mental health support needed, and what specifically about mental health would be of benefit for this?
That is a very interesting question, and I was thinking about it. As such, I would say that there is such disparity and such limited resources in the United States, and it is a complicated question because of health insurances, because of private, firms, because of the lack of expansion of Medicaid, Medicare for the patients, the ones, especially the ones who are facing the disparities. So, when this pandemic did start, and in Washington State, and as I said, in Kaiser, there was a rapid pivot. However, what we did observe is that technology per se was not easily dispersed or easily available for the older population. So I think that there might be some ways or some thinking to kind of look into how that community could sort of be, enveloped within this, because what we have seen is that mental health is worsening. As it is, there has already been a burden on the US healthcare system. And now it's even sort of like, I would say, ballooned in a way. So if we really have to think about access, and if we really have to think about equity, I think it's important to look into integrated care, which we are doing. However, it's also important to meet patients where they're at. When we talk about mental health and segregate and separate it from physical health, then that becomes the problem. What we are trying to do right now at Kaiser is to really embrace the collaborative care model, wherein we integrate psychiatrists or case managers and social workers within our primary care or specialty care, such as OBGYN or neurology, and attempt to meet patients where they're at. We do use standardized models of screening, such as the PHQ-9, G87, and now even the Ptsd scores, that we try to kind of identify and be proactive about that. But as I said, I'm going to keep this very short and simple. If anyone has a solution in terms of how we can actually enhance it, make it more equitable, make it more fair, I'm all yours, because I do think that it's a very complex system, at least in the United States. Thank you.
Thank you for that, Dr. Vaidya. And you rightfully brought up a point about mental health involving more than psychiatrists and psychologists. There's, counselors, psychologists, psychiatrists, and being able to meet the patient where they are with those services. So thank you for that. Raymond, if you could kindly comment on this briefly as well, please.
Sure. So telehealth, right? It includes direct services to clients or patients, but it also is the integrative behavioral or integrative care model, which is care coordination, and then there's training through telehealth. So, like for us as a training institute, we look for what is it that behavioral health clinicians need right now, and when the pandemic hit, they need to know how do we make sense of a pandemic and the impact on people? So we had experts in the country provide a free live webinar covering that subject. Resilience, self-care. We had experts come in and talk about the impact of the pandemic on anxiety and depression and grief and how to treat those. So providing training virtually for clinicians when something like this comes up is really helpful. I mean, we trained tons of people. They found it very, very helpful. So that's one thing. The care coordination and integrative care using technology allows for that, because it's hard for clinicians to get together in the same room for rounds, right? So they just use technology. So even different healthcare organizations, interoperability, using health information exchanges, right? So that technology piece is huge. And along that lines is good statistics and data, right? So telehealth allows for that. It allows for those surveys for the clinicians throughout the workflow of a clinical visit, putting in that data that can then be analyzed on a national and global level, I think is really important. And then the direct care delivery to clients, like which was already stated, providing services to clients, patients in a way that's convenient and accessible. We want care to happen, right? So we have to meet the clients, the patients, where they are, how they want the care, et cetera. So if people are concerned about stigma, just going online for care, getting access to different treatment modalities in a way where they're not going to be maybe seen by their neighbors is really important. And then getting access. Often people have a really hard time, and I know here in the United States, to find a clinician locally that they feel comfortable with, that has availability, that specializes in what they're looking to work on. So, telehealth very much broadens the availability of clinicians for clients that need help.
Thanks for that, Ray. And I think you brought up a point as well with regards to stigma and kind of trying to meet people where they are. So a very important point. And again, for yourself being the CEO of the Telehealth Certification Institute, we're very lucky to have your comments on that as well. Dr. Gkouvas, the floor is yours for your comments on this, please.
For another time, Mr. Barrett covered me in a much broader space. I have to say that it's obvious that the stigma and the problem of accessibility is always, it's the main problem in telemedicine. It's why telemedicine exists. And all these situations showed us that we have to see it through, because people want to see the doctor, but they want to find a way for the doctor to be nearby us, to be affordable to do it. And the technology helps to do so. They want to feel that no one is going to know that they went to the doctor, and blockchain and the way Solve.Care works is something it's a nice way to do so. But we have mainly to see the simplicity of the issue and see how easy it's going to be for the people that they're not friendly with using computers. And I'm going to come back to the thing that I was saying earlier regarding education and ways to communicate both to patients, but to doctors too. Doctors seem that because they are scientists that they probably know their business regarding online, but they don't. And also certification and training is very crucial, as my colleague says. But other than that, we have to be very good on giving them the exact picture of what telemedicine is and in what spaces it's needed, because you know that doctors are very easy to find problems. They're born to find problems. They're not born to see the solutions first. That's why we have to be very specific on what we say and what we give them through technology. In rest, I think that the future is bright for all those who know and want to do this, to make this thing work. I think it's going to be okay.
Thank you for that, Dr. Gkouvas. A lot of very important points. Cindy, if I could turn it over to you, please, for your comments.
Absolutely. Well, we can see immediately that telemedicine has come to the rescue, right? Like, it's been a part of the hero as well to be able to allow and provide access. Technology has opened doors for mental health professionals to be able to provide secure and ongoing care for people who are unable to or uncomfortable or physically be able to be in the therapy offices. We saw this right at the beginning of the pandemic, when everything was shut down, when everyone was feeling a lot of fear, not knowing what to do, leaving the house, but then also needing to continue, right, with the clients that we had before, continue ongoing care. So, having that access that has been around for a while, right, and being able to kind of jump onto that and learn. And I think education is a big part of it. And I agree, like being able to educate practitioners, being able to educate clients and patients in how to use, but it's allowed for, mental health professionals like myself be able to provide services, and also not limited to proximity anymore. So the location, right, in terms of people having access or choosing our clinic, for example, had to do with walking distance, right, availability. And now it's that, myself as a I would say that, for instance, like as for myself, there would be a particular type of people that maybe want to provide access or have access to the kind of work that I do. And that, maybe your expertise or your background isn't something that exists in every city, but the fact that people can access you now from a far place, that actually provides perfect care and way that is a fit. And a fit in care, as we know, is what it takes to be able to have ongoing wellness happen.
Thank you for that, Cindy. And yeah, very rightfully mentioned, especially in mental health care delivery as well, there needs to be that fit. And I think, as you appropriately mentioned, is patients now have access to providers from a different area as well. It doesn't have to be within their explicit geography. So thank you for that. Dr. Telang, if I could turn it over to you last, please.
Sure. I have 2 points to make, and I think this is a time when people have realized that reaching out a doctor on telemedicine platform is much easier than taking an appointment, particularly during the events of emergency. Reduces stigma, economically more viable, because they don't need to have to commute to that place and back again, saves them money. And I think this is one thing, like telemedicine is post-pandemic there to stay, and it's going to be a way forward. I think post-pandemic telemedicine is going to be a major option.
Absolutely, rightfully said, Dr. Telang. I think it, as also Cindy had said as well, technology has come to our rescue. And it's, as Ray had also said earlier, there also needs to be contingency planning. So I think one of the lessons we hope to learn moving forward is that not only do we rely on technology, but we move forward with technology that has that contingency built into it as well. So that would kind of end our session, putting our infrastructure questions to our panelists. We have just a list that goes on and on of questions. So it's been a very stimulating conversation. We have a lot of questions. I will do my best to get through as much of them as I can. We have 30 minutes left in our round table. So what I'd like to do is start with our first question, put it forth to our panelists, and I will allow our panelists to kind of choose who would like to answer that based on their area of interest. So question 1 comes from one of our attendees, Aditya, and her question is, I would like to ask some community solutions that can develop to build a strong mental health within people, leveraging technology. She mentions further that Dr. Telang had briefly touched upon it and would like to hear from our panelists a little bit more depth pertaining to that topic. So maybe Dr. Telang, since she mentioned you specifically in the question, I'll turn this forward to you. And if you need me to repeat any part of the question, please let me know. Oh, you're on mute, Dr. Telang. Yeah.
If I understand, she's asked about how to develop a group therapy or maybe NGO system where you can deal with a group therapy. For that, a group has to be formed, confirmed. The consents have to be taken from them to be part of that group, which has become very legally important now, to have the consents from each and every member in that group, and then go on with one by one, whatever the topic. If they desire knowledge about mental health only, then you go on explaining what is mental health, why necessary, and make modules for it, each one of them, and you have to have specific timings set for it, for the interesting groups. And that's how one can move forward on preparing these groups and providing knowledge to these groups, as well as there are help groups where these people can ask for help. And so a group therapy can also be set up in those groups.
Makes sense. Thank you very much for that, Dr. Telang. I'll move to our next question. Our next question comes from Linda. So she mentions here in a question, she is a counselor practicing in Malaysia. And her question goes, it seems like online mental health services will be a general practice now, as well as post-COVID. She asks how this will change the current education put forth towards counselors. If any of you would like to answer that first, please feel free.
I'll jump onto that one. I think that a big portion of this will be, as things go on, we always have to shift the way that educators and, practicing therapists in school learn, which is that online security, privacy, protocols. There's this level of, reading certain things that you have used to be reading in person, physical things that you would be reading between client, patient. And now you have to do it over online in a screen. So I guess there are certain things that you need to see, look for, ask for. I think that will be a big change in the way that we will be educated in terms of training and how we navigate that. And perhaps being able to learn about structure and boundaries that we are be asking, making sure that the clients or patients have privacy, security, what they're talking about won't endanger them furthermore when we kind of end the session is probably a big part of education that I think that will change.
Makes sense. Thank you for that. And I guess, as you rightfully mentioned, education is also changing as well. So as we develop and integrate these new tools into educating providers as well, it seems as though the structure and curriculum will also develop with time as well. Our next question comes from Wahida. So I'll read her comment and question here. So it says, very good point raised by Dr. Vaidya, having an integrated approach. There is a lot of stigma and lack of awareness about mental health per se. We started telecounseling services, but the response was poor. So she mentions only cases of domestic violence came into light within this. How would you popularize or promote telehealth in rural areas such as remote villages in different parts of the world?
Yeah, sure. Thank you for the question. And I think that's a great question, Vaidya. And that really does, kind of get us thinking about accessibility to care, access to technology, quality issues. What would be the costs to even kind of have these equipments, especially as you said, in villages, in places where there is that cost infrastructure issue. And this is where I would say that the NGOs or organizations or even global kind of approaches would sort of help in terms of whether it would be sort of outreaches or education via utilizing teleplatforms and how they could utilize it. There might be some boots on the grounds in the beginning, to get this kind of infrastructure on and running. But yeah, it's going to take a lot of thinking, a lot of proactivity, and a lot of people who are really passionate about this and understanding how important it is to be proactive about telemental health. The other aspect I also wanted to talk about was in all these things, which I'm thinking about, is security of the sessions, as somebody pointed out. And, we all know different teleplatforms, they have been HIPAA secure, HIPAA meaning, kind of making sure that the patient's security, the patient's information, that's not being affected. But what I actually thought about Solve was the fact that it's a decentralized platform. So that's what makes it a little bit different from other platforms, because it does actually give you the ability to encrypt data. So there is a direct connection, right, between you as the therapist and the patient, and the data is exchanged only dependent upon both consent. So those kind of things will also improve patients' ability to trust such platforms. And I think that's the big important word I'm going to use here, which is trust. That's how you popularize telehealth, by making sure that it's secure, by making sure that it is something that their data would be protected. It is the data that they control, whether it's the doctor, whether it's the therapist, whether it's the ancillary staff, the care managers. So I think that you're going to see such platforms, and maybe there might be a way to make it more economical, by utilizing NGOs or other kind of organizations or global sort of initiatives. Thank you.
Makes sense. Thank you for that, Dr. Vaidya. Our next question, just kind of based on the context of it, Ray, if you don't mind, I'll pose the question to you. I think being the CEO of your organization, you would have appropriate insight into this. So this question comes from Nikos, and his question is, how do we prepare for people to use telehealth as a first recourse or a first response to asking for help with respect to the fact that not all people are tech savvy, as he puts it?
Yeah,
So sorry, it was for me or for Ray?
Oh, apologies. By all means, Dr. Gkouvas, you're welcome to comment. I thought I'd put the question first to Ray, and then if you want to provide your comments.
My bad. No.
Oh, no. Oh, yeah. I think that the question, it was from Nikos, but yeah, I understand. Sorry about that.
Oh, yeah. Okay. Yeah. So on the organization level, having a process for that. And part of it is having the staff themselves, having buy-in, being motivated, being comfortable, being trained. So, when someone calls seeking services, if the person receiving that call or receiving the inquiry is speaking positively about the options of telehealth and they themselves are comfortable with it and they are comfortable with walking through the prospective patient through the process of getting services, that's going to help a lot. So if the staff are not trained and they're not so comfortable and they're not so positive about it, it's going to come off to the patient. And then we call it a tech check or a client orientation process. So there's the marketing, then there's the tech check and client orientation. So the marketing should be like, this is available, it's easy, you have a quick video demo on your site that shows how it works. And then the tech check client orientation, you can give instructions to patients in multiple ways. One is written out step by step on a website. Another one is walking them through it over the phone when they call. Another one is to have a short video demonstration on your website. So having the instructions in multiple ways is really helpful. And then asking the question, not assuming that people know how to do it. Even if someone comes from a certain demographic that you think, oh yeah, they know how to use technology. Well, they might not know how to use your technology, right? So you ask them, you can ask them to repeat the instructions. How do they understand how they're going to attend the session? Do they have the technology available? Do they have any questions? Would they like you to walk them through it over the phone or when they're in your office with you? So I think having training staff and then giving staff a script to use when they're interacting with patients, and then giving those instructions to patients in multiple formats, all of those things help a lot. And obviously the technology being super simple, easy to use, integrated in a way that people are going to be accessing. So one thing that organizations have found helpful is from the beginning, get patients using those patient portals, right? Walk them through the process to actually make those first connections with the patient portal rather than just handing it to them like, oh, by the way, we have a patient portal. Good luck. No, like this works. This is how it's helpful to you. Let me help you get set up now, right? So yeah, there's definitely things you can implement there.
Got it. That makes absolute sense. And I think that structure that you mentioned as well is important. And also providing patients, as you so rightfully mentioned, kind of to use the features from the get-go rather than saying, here it is, try it if you want. So that makes absolute sense. Dr. Gkouvas, I'd also like to pose the same question to you as well, please. How do you feel that, patients can use telemedicine as a first response, especially to those who are maybe not so tech savvy?
There are already a lot of solutions that are extremely easy. By pressing a button, you can see someone. Of course, there are others that you need to have some more knowledge about how to download this software or making an account or whatever. But it's very crucial to identify in the end what's the emergency, which is the patient that can use technology in an emergency setting. The emergency setting changes. For example, a suicidal patient shouldn't be using something through the internet because it's kind of difficult to do what you have to do to help me cope with it. So I would think that we have to educate people more and give them access to more educational videos and maybe some things inside in any platform that shows you the way how to do it. But there are a lot of solutions. I believe Solve.Care too. There are others like Melapus that do. They're very, very easy to use in an emergency setting.
Makes sense. Thank you for that, Dr. Gkouvas. Our next question actually comes from Yatan. So his question is more in the context of, an employer and possibly offering, to expand on this question just a little bit, possibly offering telemedicine services to employees and integrating that for employee well-being as well. So his question is, as a responsible employer wanting to ensure a successful return to work, what factors should we include and what do we do to support those who haven't taken time off, but we may recognize that they need that? So this question seems to be more specific towards the mental well-being and kind of the mental health of staff as well. Dr. Gkouvas, would you like to comment on that briefly, and then we open it up to the rest of the panel members as well?
Of course. I believe that there's this huge shift now worldwide about companies wanting to help their staff to have a mental health well-being, not only after COVID in general, because they are kind of in a burnout mode before COVID, and COVID went the thing and make it huge. So solutions like Solve.Care that has the ability to give to someone easy access to a mental health professional with anonymity, and feeling that his boss ain't gonna know about it, because it's a very crucial thing. For example, I know in Teleperformance is a huge, company all over the world that it makes phone calls. They're kind of young people doing phone calls for any kind of reasons. So they choose to get psychologists and put one psychologist per floor in all the company. No one, I repeat, no one went to see the psychologist in 2 months' time, because it was obvious that nobody would want in front of his colleagues and his bosses to perform like he needs counseling to go forward. So any kind of solution that is telemedicine-wise, that can give the solution that is anonymized and you can use it without being stigmatized of using it, it's very crucial. And in the workspace environment, seems there are a lot of investments in companies that deal with it. And there's a huge turnout that we have to focus on it and see what we can do to help people in their workplace.
Thank you for that, Dr. Gkouvas. Cindy, given your work as a counselor as well and possibly working with different corporate levels as well, would you like to comment on this?
Yeah, I think that it's important to recognize that, like I said, there's a pivot in our society at this point in the way that the world has changed. So even post-COVID, will we all physically be back in the office? Probably not, right? So the kind of care that will be necessary as an employer, it's actually really great, the question that is posed, and it's important to navigate that, because a lot of your employees are not commuting to work anymore. There's like this shift in sort of like the responsibility and at home and the pressures that are happening. And just like Dr. Nikos said, right, with the, anonymity that you get to be able to just click in, maybe have a session, maybe have a check-in, right? Those things are available to them now, and that they don't have to physically admit to other people because of the stigma. And as we're working towards, the stigma and sort of normalizing it, it still doesn't change the fact that right now, the availability with telehealth and the options for, people to be able to access, right, and have these check-ins, and maybe not in a mandatory way, but considered as like, the way that companies would have Friday get-togethers as a way of like this, thing that you do to be able to have your check-in, right, to make sure that you're decompressing in a way, right? You can even rename it in a different way so that allows it to be more accepted. And I think that that's a great way to look at it. And, recognizing that as things change and as we go back to what the new norm looks like, there's all of these other ways that we have to improve. And one is that telehealth provides this ability, right, to have this check-in. And because we're isolated, we're at home, right? Being able to have that implemented in a different way from employers is actually the first step, as opposed to employees asking for it.
Makes sense. And I think, you appropriately mentioned that proactive kind of offering is what's needed rather than having the need come later. Makes absolute sense. Our next question comes from Mario. And Dr. Vaidya, you had commented on this topic earlier. So maybe once I ask the question, I'd like to put it forth to you first and foremost. So Mario asks, how do we ensure confidentiality in using a telehealth platform or portal moving forward?
Yeah, I think, I was actually talking about that. And, there are several platforms, as I said. And one of the uniqueness of something like Solve is the decentralized aspect of it, which is basically what banks are utilizing. But having said that, I think, each company has their IT tech teams working on exactly ensuring that and creating and making sure that the bugs are constantly fixed. I mean, we all know about Zoom, right? We were all on this, and we were privy to what happened with some of the bugs that happened, and Zoom was hacked at some point. So I think it's very important to partner with any company, wherever you're working with, in terms of the IT staff force, to ensure that any such bugs or any things are constantly being updated. I think it's highly important and ethical for every organization to ensure that their patient data and that their patient evaluations and meetings are highly secure. And so this is what would be the need for kind of like popularizing telehealthcare everywhere, so that there is a comfort level for people to seek this modality of treatment, which has now become the new norm. I mean, there might be a hybrid way of looking at things. Maybe there might be some people still coming in person, but for the most majority and for the large part, patients are also choosing to not want to come anymore into the offices for obvious reasons. So the more secure we make these platforms, the more popular we can actually use this modality as the modality of treatment.
Makes sense. Thank you for that, Dr. Vaidya. And I'd like to pivot back to, Dr. Telang. By all means, if you wanted to make a comment, that would be great. You're just on mute, Dr. Telang.
I would like to say that in this, if somebody can explain and put all these recordings or under an umbrella, start a blockchain kind of an technology, we can assure companies about its safety. Being a blockchain, it's so difficult to hack it. So maybe the companies can start it under blockchain and make it more secure and explain it to the people who are going to be taking the benefit of this kind of an help.
Thank you for that, Dr. Lang.
Yeah.
And I think you'd mentioned that point rightfully so earlier in terms of kind of this need for an umbrella network to kind of manage these things moving forward. So thank you for that.
Yes.
Let me remind you the hacking on Vastaamo of Finland, that all the data of this mental health startup were taken by a hacker, and then he extorted both the company and the users about exposing them because they weren't secure as they supposed they should be. That happened a couple of years ago. And the importance of having the data correct in like blockchain, for example, or any other way of working with data is very crucial on moving forward.
Thank you for that, Dr. Gkouvas. So looking at the time, I think those are the only questions we're able to take at the moment. We tried our best to answer as much as we could, but we have a few minutes left here on our scheduled roundtable. So what I'd like to do is just turn back to our panel members and just ask for their closing comments one by one. So Dr. Vaidya, the floor is yours for your closing comments.
Yeah, so just in closing, I mean, I would like to say that mental health care, it's very crucial. It's right now in the forefront, and we need everybody, I guess, around the world, invested in this, because it is a global community at the end of the day. So I'm just hoping and, looking at programs that are going to evolve and that are going to have solutions to even enhance it and make it more accessible for everybody. Thank you.
Thank you for that, Dr. Vaidya. Raymond, the floor is yours for your closing comments.
Yeah, the thing that comes to mind is kind of like a call to action, is to think for a moment in the organization that you work in your family, in your friend networks. How is it that you could normalize getting mental health care in the conversations that you have with people? How can you normalize that? How can you bring it up in conversation to give a sense that it's normal and it's okay to get help in a time of stress?
Thank you for that, Ray. Very appropriate. Thank you. Dr. Gkouvas, your closing comments, please.
Yes. We all know before COVID that mental health was around us, and with baby steps, people were talking that having in every city, in every family, in every house, somehow somebody had a problem with mental health issues that would maybe be just a problem with sleep or any other COVID get us together and give us an opportunity to see mental health as it really is. It's a global issue. I think that is the new pandemic, in my opinion, even if I sound kind of horrific in a way, but I believe it's the new pandemic after COVID, and we have to be very vigilant on educating people and giving easy access to everybody to mental health from wherever he is at any case.
Thank you for that, Dr. Gkouvas. Cindy, your closing comments, please.
Yeah, so, collectively, I believe that there is an understanding that we need to prepare and that we are all working towards it. However, there needs to be a more coordinated effort of all of the mental health practitioners, like you see here today, having this conversation surrounding the aftermath, surrounding what is going on. And, the key thing that I want to kind of bring in, the change that I'm trying to bring, is that therapeutic care still needs to be seen as a necessity as opposed to a luxury. And that's something that, we're trying to shift every day, but it requires the efforts of the people, the government, right? Like there's a lot more that is involved in order to shift that stigma.
Thank you for that, Cindy. Dr. Telang, your closing comments, please. You're on, oh, there we go.
Well, yes, I was unmuting myself. Sorry. I would say that we anyway define health as physical and mental both put together. That's where Dr. Vaidya had said that it should be an integrated program. So there is no health without mental health. And this message has to reach people that there is no health without mental health. And to get a proper mental health, this is the best way to reach help without being stigmatized. So telehealth would mean health, mental health, to reach a complete health without being stigmatized.
Thank you for that, Dr. Telang. Absolutely. There is no complete health without considering mental health as well. So thank you for that. So we have reached the end of our roundtable here. I can say for sure myself, I have learned a lot from our esteemed panel members. This has been very eye-opening, very relevant topic, of course. And I thank you all very sincerely for your time. I know you're all very busy, so thank you for joining us today. It's been an absolute pleasure. I'd also like to thank our audience as well for participating and putting questions forth. Hopefully we are at the end of this process of this context of COVID here. As mentioned before, what can't be understated is the tragic loss of life that has occurred. But moving forward, as humanity, I hope we can move forward and learn from some of the lessons we've learned. I hope to connect with you all again in the near future for our next roundtable. But until then, I wish you all well-being and health, and thank you again for being part of today's call.
Thank you very much for giving us a chance to be on the platform. We look forward.
Thank you,
everyone.
everyone.
Thank you very much. And get vaccinated so that we can move forward.
Thank you all.
Thank you all.
Thank you all.
Thank you.
Thanks, Raymond. Thanks, Cindy. Thanks, Ahmed.
Thank you. Bye-bye.
Bye.
Bye-bye.
Bye-bye.